starting with today's program. So good evening to everyone and a very warm welcome to Mo TV. So today, as you all know, we have Dr. Raj Gopal with us, and you all know him very well. He's been coming here very often and we've had wonderful sessions with him. So coming to today's topic that he has, what he wanted to talk about. So it is about food being a medicine. So just talking about it. So food brings people together on many different levels. It's nourishment of the soul as well as the body. So as I mentioned, we have Dr. Raj Gopal who will be talking on this topic of food as medicine. And we all have acknowledged the health benefits of foods. I think कल भी हमारा नेचर पे भी जब हम सेशन कर रहे थे तो बहुत कुछ हम लोग किचन में से सामान लेके आ रहे थे जो एक मेडिसिन की तरह भी काम कर सकता है, how nourishment and all that it gives us. So, but however, with the development of chemical drugs and the pills, we have forgotten that the food we eat is directly linked to our health. Foods, in fact, are the best medicines, and therefore we should take into account how we intake them and use them. So food has the power to prevent the illnesses that we experience today. And it makes a lot of sense to alter our diets, to use it to our own advantage. And this will not only heal and restore the body, but also prevent many illnesses that we have. So to elaborate more on this, we have Dr. Raj Gopal with us. And as you all know, Dr. Raj Gopal is a wellness physician, writer, editor, independent researcher, columnist, and author. He has published his published work includes hundreds of newspaper, magazine, web articles, essays, meditations, columns, and critiques on a host of subjects. He has written 8 books on natural health and encyclopedic treatises on Indian philosophy. At present, he is the Chief Wellness Officer at Doctor 360, which is a mobile health application which helps in connecting patients with Ayurvedic and homeopathic physicians and nutrition therapists, among others, from the comfort of their own homes. So with this, I welcome Dr. Raj Gopal to Mo TV once again. And Dr. Raj, it is always a pleasure to have you here. And I think everyone here looks forward to the programs that you bring to us. All of them are very different. Each program that you've done with us has always been from a different genre. Last one we had was on music, therapy, etc. So earlier it was, the alternate medicines that we should be using. So looking forward to today's session also. So over to you, Dr. Raj Gopal. One second, you are on mute.
Hello? You're able to hear me? Hello?
Yes, doctor.
You're able to hear me, right?
Yes, doctor. We can hear you now.
Okay. Good evening, everybody. It's always a pleasure to be with you. And the topic today, as Ritu has already described, is let food be your medicine, and food as medicine, as the case may be. We all know that food is intrinsic part of our cultural landscape. You could call it this way. What we refer to as cuisine is both an art and science. It is an art when it strives to bring about the realization of the true and the beautiful in the order of culinary ideas. And as a science, it respects chemistry, physics, and natural history. You could call its philosophy gastronomy. Food as medicine or functional medicine offers us a natural, holistic mode to explore deeply into the core imbalances that highlight various illnesses and emotional states. Put in perspective, it looks at the essence of the diagnostic process as being fully geared to expand on our body's piano notes, as you may call it, to analyze and also accept expanded information. You see, our traditional illness model is key to look at specific causes. It's not all encompassing. Do you sometimes feel there could be something more to your health giving and spiritual armamentarium? Yes, we all think of it often. It is this glow that provides the light for us to think of functional medicine and natural well-being as a practical component of the complex interrelated network of causes that eventually manifests as illness. You could think of functional medicine and also the best expressed definition of health and well-being as positive vitality, with wholeness being the all-inclusive principle of our body, mind, and spirit. It is this attribute that provides us with the ammunition to fully live healthily, happily, and energetically. This also offers us a dynamic approach to assessing, preventing, and treating not just acute disorders, but also complex diseases and syndromes. I'll just give you an example of how nutrition can be used as therapy, or what we call today as nutritional medicine. There is this case of a 32-year-old woman with progressive muscular weakness and pain who went through a high-tech medical examination. There was no diagnosis made, which is a common thing, as we have heard from people or from friends around, that they've undergone all the tests and doctors have not been able to figure out what exactly the problem is with them. So coming back to the case in point, after 2 years, she was confined to a wheelchair. It was at this point that a meticulous, wide-ranging scrutiny of her problem revealed a possible underlying cause. You know what the cause was? It turned out that the woman had chronic Crohn's disease, an inflammatory disorder of the digestive system, which was conventionally treated by removing a part of her colon. As a result, she was not absorbing vitamin D, the deficiency trigger for her muscular debility and pain. So following vitamin D replacement therapy for just 3 weeks, she was able to walk without any assistance. The source is from the Lancet, the respected medical journal. Now you get the point. Functional medicine or functional foods add a new dimension to good health and medical treatment just as well. In addition to this, it also offers a useful roadmap for any individual, medical or healthcare professional to improvise, as I said, the piano notes, so to speak. What is more, it can also help us, not in just treating ourselves, but also helping others. You can think of this. To put it simply, it not only helps patients, but also healthy individuals to experience deep, lasting healing and also to place appropriate corrective or remedial medical or surgical treatment on the fast track. Functional foods meet our minimum daily requirements of nutrients when taken in appropriate amounts on a regular basis. Most importantly, they are also evidence to promote vital or vibrant health and reduce the risk of disease. They also help in the management of major health problems such as heart disease, diabetes, gastrointestinal disorders, menopausal distresses, osteoarthritis, osteoporosis, and cancer, not to speak of relatively less serious conditions like sinus infections. Most nutrition professionals or nutrition medicine exponents have identified hundreds of compounds with functional qualities, and new discoveries are being constantly made surrounding the multifaceted benefits of functional foods. I think I've already explained or touched upon the definition of functional foods, but I would like to repeat again. By way of definition, functional foods are natural bioactive chemical compounds that have health promoting, disease preventing, and medicinal properties, as Ritu also touched upon, during our introduction. You may think of all foods as being functional because they provide nutrients. You're right. However, functional foods represent foods that have health promoting ingredients or natural components. These are components that have potential benefits in the body. They include whole foods that are fortified, enriched, or enhanced as dietary supplements. Also, or you could think of dietary supplements as those foods that have been enriched. Maybe it could be in capsule form or whatever you could think of. They all have beneficial effects on our health beyond basic nutrition. So let us go back into the origins of functional foods. The concept of functional foods is not new at all. It's not a new phenomenon. It has been just perfected over the years. To highlight one classical example, we have all heard of iodine in salt. This manufacturers happen to add iodine to salt in an effort to prevent goiter in the 1900s or in the early 1900s, about 100 plus years ago. This was perhaps the first attempt man made at creating a functional food through enrichment. Many of the foods that we consume are natural whole foods. They don't become functional foods just because we know them by that name. Functional foods are derived from agricultural breeding or through added nutrients and ingredients. Nature has provided us with a rich variety of fruits, vegetables, grains, fish, meat products. Think of what you may. They all convey health benefits far beyond fundamental diet. Some examples: lycopene, the functional component in tomatoes, omega-3 fatty acids in fish and flaxseed, and saponin in soya. The nutritional content of certain crops are also used to bring about beneficial traits in plants and animals. I'll illustrate two examples: beta-carotene-rich rice and vitamin-enriched soybean. Yes, there are several other examples of fortified foods available in the market. Orange juice, for instance, is fortified with calcium. Cereals and flour with added vitamins or minerals or folic acid are also available, as you know, in the supermarket. There is, of course, no single functional food or potion that can cure or prevent health affections. It is not that, if you take, good quantity or, well-balanced functional food or add them to your diet, it's not that you will be able to beat disease. The only thing is, it will sort of give you an insurance cover, so to speak, like how you took the vitamins, how you took zinc, just about everything, maybe vitamin D3, when the COVID-19, sort of came upon us. So this was a sort of insurance cover, so to speak. So the best and the easiest thing for us to do is simple. Eat a balanced diet, one thing, and also a varied diet. Just not repeat same thing day in and day out. Maybe you ought to bring certain changes in your diet, make it more interesting. And if you add at least 3 to 4 servings of fruits and vegetables a day, I think that's the best thing to do. You would also note that it's always good to read labels and scan through them, as to what experts in the field advocate, and also by way of articles in the media. You have a lot of information out there. So when you read, you'll get to know the composition, the quantity, just about everything, of the packaging, the food, the functional food, or whatever as the case may be. So it will give you good information, to sort of broad base your plan of action vis-a-vis your diet. And however, before you decide on making any major dietary changes, you ought to take adequate time to weigh upon your personal health, weigh them vis-a-vis your personal health and supplemental needs with your physician or therapist. You know, Please don't get into the idea of changing your diet overnight unilaterally. You need to sort of consult or speak to a professional, and he or she will be able to draw a plan of action or a planned diet that fits your body and your needs best. So now let's go into nutraceuticals, which is now a very famed word, so to speak. Just about everybody, not just in India, worldwide, they all know nutraceuticals. Though the thing is catching up in India, thanks to our health awareness and consciousness being on the ascent. So nutraceuticals form a great range of supplements such as vitamins, herbs, minerals, amino acids, phytochemicals, and so on, which can be used to treat a variety of problems, chronic or otherwise. They are also most adaptable, providing the most promising, tangible, just let me recall as to what I said. Yeah, tangible benefits in both health maintenance and medical treatment. Nutraceuticals have evolved on a truly scientific pedestal. They are broadly based on one of medical science's most wholesome dimensions, the study of uses followed by results. Nutraceuticals stand up to evaluation assessed on measurable scientific parameters. You can call them in one word, super nutrients, because nutraceuticals seem to know just where to act in the body and bring back that great sense of balance to your entire being. Now let us pick up a few examples. You've all heard of fortified foods. These are items such as breakfast cereals with added vitamins and minerals like iron, zinc, vitamin B12, cobalamin, and folic acid. There are also vitamin and mineral supplements available. These are available as separate supplements or as a combination product with varied amounts of different substances. There are also additional supplements other than vitamins and minerals. These are suggested to have a beneficial effect on health, not just in health, but also in illnesses. I'll pick up a few examples for you. Fish oil, garlic, chromium picolinate, echinacea, primrose oil, ginkgo biloba, quercetin, glucosamine, coenzyme 10, Q10, and so on. And of course, you all know about probiotics. It's a big word today, for their excellent health benefits. These foods contain good bacteria. The idea of to have good bacteria is to kill all the bad guys. But of course, you have what is called as microbiome in our intestine. There ought to be a balance of good and bad, bacteria. Okay, that's the only way to lead good health. You cannot have all the good things and drive out the bad thing, but you also need a bit of both, and also, maybe good bacteria, good measure, and bad bacteria. So that is where there is what is called as balance. Okay, and one good example of probiotics is yogurt or curd, which all of us are fond of. And yogurt curd, they contain lactobacillus, a bacteria that is suggested to improve gut health and also reduce the incidence of heart disease and certain forms of cancer. It is also perhaps good for those who have arthritis, because there is a school of thought, also an established thought, that arthritis could also be triggered possibly by a bad gut. So now we move on to foods that could help reduce cholesterol. Of course, cholesterol is a big name, big thing, but there is also a myth to it. And, it's not what it is being made out to be. It's not just one villain of the piece. It is always a cumulative effect of certain things that affect health and also trigger illness. So we need to sort of look at other factors, which in sort of collaboration with cholesterol may lead to bad health. Okay, let's look at the foods that help reduce cholesterol. One is spirulina, the other is licorice. They're both evidence to lower cholesterol. So let's go back a bit again and look at the whole perspective. The most ideal thing for us to do is to eat smartly and follow a healthy dietary regimen with appropriate dietary supplements or nutraceuticals like fish oil, green tea, ginkgo biloba, garlic, bilberry, flaxseed, the B vitamins, most vital, vitamin C, vitamin E, the great antioxidants, glutamine, magnesium, then licorice, as I've already told you, quercetin, the queen of anti-allergic remedies, probiotics, the good bacteria found in yogurt and curd, and red clover that take care of your unique individual requirements and needs. But again, one more thing. I would like to emphasize that please speak to your physician, therapist, or healthcare professional or provider, nutrition, dietitian, on the use of functional foods, including appropriate supplements and their dosages to lead a life filled with optimal health and well-being. Now, let me just look at the other side of things, or let's call them everyday miracles. See, we all eat tomatoes. Tomatoes are evidence to cut the threat of deadly prostate cancer by nearly half. A small dose of vitamin folic acid can prevent dreadful and common birth defects, which we all know. Eating fish and supplementing your diet with fish oils helps your body's estrogen levels dramatically alter in favor of the most protective anti-cancer form of estrogen. Okay, for some of us who are pure vegetarians, we may not have a choice, in the sense, if we can't take fish oils, probably we could shift to flaxseed. Okay, now you also have vegan fish oils available, or rather omega-3. That would be fine. Broccoli can cause a powerful change in the estrogen balance and prevent cancer. Fish oil capsules taken for just 12 to 14 weeks slows down the growth of colon tumors. Olive oil lowers the risk of breast cancer and also heart disease. Green tea can cut the risk of heart attacks. In fact, let me quote a study from, I think, the British Journal of Nutrition. They found that subjects consuming flaxseed for 4 weeks not only increased their levels of omega-3 fatty acids, but also reduced their cholesterol by 9% and their blood glucose levels by 27%. A study from New York showed that red clover, which is, I think, Simicifuga racemosa, had about 30 times the amount of natural estrogen as soybean, a natural hormone balancer. Red clover also seemed to ease hot flashes in menopausal women. There are reports that the plant pigment quercetin, which is found in green tea, onion, etc., possesses the highest amount of natural anti-allergic activity. Studies have found that probiotics may be helpful for people with irritable bowel syndrome, IBS. So this is about let food be your medicine. And I would welcome questions if you have any. Thank you. Hello. Hello.
Sorry. Hanji, ladies and gentlemen, any questions for Dr. Raj? सब इतने ज़्यादा बिल्कुल उसमें आपके सेशन में खो गए डॉक्टर राज.
No, I thought whether my voice was reaching out to you guys.
Yeah, it's very well reaching, Doctor. Good evening. It's a very wonderful session. On behalf of the entire team, I owe a very big thank you.
Oh, thank you. You made my day.
So, ladies and many questions. I know whatever he says is always very self-explanatory and in very simple words, and सबको एकदम से like we relate to things that he's talking about. But still, anything since he's here and he has so much of experience. So, any questions that anyone wants to ask?
Yes, ma'am.
It was so informative. It was so informative that we got the information from him.
There was someone else.
Ma'am, can I ask one question with your time permission?
Please do. Yeah. Please do, Ranjit.
Sir, I have a question. The osteoarthritis, how do you see to it if it is very chronic, like say about 10-15 years old?
I'm sorry, I didn't get you.
No problem, Mr. Raj Gopal. I can repeat it again.
Yeah,
I said the person who is suffering from osteoarthritis.
Yeah.
And it's a chronic one, like 10 to 12 years old. And the person is taking a supplement, glucosamine, omega-3, and some green tea. So could you please highlight what else is to be needed?
Osteoarthritis or osteoporosis, because if one is taking glucosamine, it is more for osteoarthritis.
Yeah, I am asking about the arthritis.
Yeah, glucosamine, is quite good, if it is the early or the middle stage or the subacute stage, as we call it. And along with the glucosamine, there is something called as chondroitin. That makes a good combination along with Boswellia, it's used in Ayurveda just as well. Okay. So the combination of glucosamine and chondroitin is more or less like 1500 mg of glucosamine and 800 mg of chondroitin should be taken every day. Okay. Along with flaxseed would be a good thing to add on as supplement, which you can easily buy from any provision stores.
Correct.
Okay. And you could grind flaxseed and take it in powder form, or you could even roast flaxseed and take it, and it's quite palatable that way.
Okay. Thank you, doctor. Thank you so much, Mr. Raj Gopal.
But the thing is, one needs to sort of change lifestyle habits, etc. Try to be active, that's one thing. But this is a slow process. It takes at least 6 months for the action of glucosamine and chondroitin to manifest in the body. And in fact, the interesting part is glucosamine and chondroitin are sort of manufactured in the body. But there is sort of depletion, it's not necessarily because of aging or wear and tear sort of thing. It's a normal physiological process.
Omega-3 also helps?
Yes, indeed. Omega helps. And that is the reason why I suggested, for those who can take fish oil capsules, fine. For those who can't, especially vegetarians, they can switch over to flaxseed. That's good enough.
Thank you indeed.
And
Thank you. Very well answered.
It also helps clear the gut, and your gut will be in good health, if you take flaxseed every day, about say 1 to 2 tablespoonful, not teaspoonful. And you should drink a lot of water, keep yourself hydrated, and you'll have very good gut health.
Thank you so much.
Oh, welcome.
Much obliged.
Mr. Bhamri, you want to ask a question?
Yeah. Dr. Raj Gopal, I hope you will agree that individual metabolism also plays a lot of role along with the food management.
Yes, indeed. It's a very interesting point that you brought.
Yeah.
Indeed. That is why it is said one man's food is another man's poison.
Yeah. So,
but overall, the basic foods which we eat, I think should go well with just about everybody. The simple, the nutritious food which we have eaten all through civilization, especially in India, that's fine. But the only thing is, what has happened is over a period of time, we have gotten into different, cuisines, and for exploration is okay, but something our body is not used to. Possibly the future generations may get used to all that. I'll give you a simple example. In Japan, they take a lot of soya and tofu. So, this is a classical stats. It says that, the incidence of cancer in Japanese women is rather 15 to 18%, something of the kind, if I remember correctly. And for those who have migrated to America, Japanese, in them, the incidence of cancer is quite high. It's almost 60+%. Because of change of food habits. They have given up soya, they have adapted to a totally Western diet, which is not in conformity with their genetics or maybe their body type. Because the body is also just as intelligent as the mind is. So it doesn't go well, like you said. It is a very appropriate thing that you mentioned, because just about everything, one size does not fit all. Same thing applies here.
Yeah.
So what is natural to us, that's the best thing to do.
Yeah, last time I talked to you that though I am a MI patient, but I found the turnaround in 5 years before when I started taking Ayurvedic, this thing, Medohar Vati and Hirdevati.
Yes, I remember you told me.
Yeah. So that's why, can you recommend to some people this medicine, or it has to be consulted with the doctor?
Which one?
Medohar Vati and Hirdevati.
Yeah, it's always better to speak to a physician before taking, because he or she will be able to analyze it better.
I got it with recommendation of Ayurvedic specialist.
Yeah, it would be better, I think.
Yeah. Okay. Thank you, sir.
You're welcome.
Any more questions?
Please, can you suggest me something for the distension of abdomen? Every time I feel fullness of abdomen, whatever food I take, I feel fullness. It is digested very late.
Okay, you have gas problems?
Yeah. I take some pantoprazole in the morning, fasted stomach, as it is told in the allopathy. In our science, it is told pantoprazole is taken in empty stomach, that I take regularly. But even then, after taking the lunch, I feel fullness of abdomen for a long time. Food is digested very late. Stomach is emptied very late. It is late peristalsis.
Okay. And here I would like to mention, during the course of my talk, I referred to red clover. It should have been, or Simicifuga is another, useful supplement for use, especially in menopausal women. with hot flashes. So I think it got mixed up. I didn't say or. Possibly I gave the name as the other alternate name for Simisic fever. Sorry, that's not the thing. They are two different things. Okay. I stand or sit corrected. Okay, ma'am. As for you, do you have your reports, etc., with you?
Everything is all right. Endoscopy is okay. Ultrasound is normal. My age is 72.
Okay.
And I have got one stunt done 10 years back. Knee replacement done 10 years back, and I had a myocardial infarction, and I got one stunt inserted about 9 years back. So, but I'm doing everything all right. I'm active, life leading, but only thing is digestion is not good. That is poor.
Okay, what exactly happens?
Fullness of abdomen. Always I feel a distended abdomen.
Okay. Whether you eat or you don't eat, before food or after food, same thing, is it?
No, after food. It is after food. If I don't take any food, I'm all right. I'm very active. After taking food, I become sluggish, lazy.
Okay. For this, I need to take a complete history. Maybe you can connect with me sometime, and we could discuss. It may take about half an hour. Okay. So you could call me sometime, and I'd be very happy to help you out.
Yeah. So anything, because nobody can give a generic medicine here because a lot of things are involved. It is not only जैसे सत्या जी ने एक problem बताई है, but then our whole medical history matters before any medicine is given. So definitely, if it's not a generic problem, it becomes very difficult to give answers here. So you can of course connect with the doctor at any point of time. You can let your relationship manager know, and an appointment can be booked.
Not a problem. Ritu, she can call me sometime, at her convenience, and then we could go through her case history, etc., and then we could think of some remedy for that.
Doctor, I have also got one question.
Work at all.
Doctor, I have also got one question.
Please.
It's the same, more or less the same problem, digestion problem. I normally take Digene. It helps me in digestion. And I normally skip my dinner also if I feel fullness. And I feel quite normal. I feel very, if I take light food, light fruits and light snacks, that helps me, that doesn't bother me that I'm feeling hungry. I also don't feel hungry. I just take really lunch, and that's it, and some fruits in the evening. And it so how to and I take Digene if I feel fullness. So is it okay, or should I take some other medicine, allopathy? So it's more or less the same.
Yeah, I think these are all dependence. It leads to what is called as dependence. You get used to it, and there is no life without one of them. Either the tablet.
Because there is less of physical activity.
Long-term usage. Long-term usage is not recommended, be it Digene or anything else, because it can also trigger other problems, in the long run. Because anything that we take has action-reaction. Okay. So the best thing for you to do, offhand, I could just suggest maybe you could take probiotic capsules, and probiotic capsules, or maybe we could even discuss your case at length. You can call me sometime, not a problem. Okay. In fact, I'm connected to IMOHA. I'll be offering consultations. There is no attached cost or anything like that for it, and you're free to consult me whenever possible. Convenient times, both of us.
If I have some issue, okay. Can I?
And, it's always better to sort of connect and look into the cause, etc. And also figure out what exactly the problem is from the inside out and then treat it.
Okay. And I also take Alprex quite often. I mean, the 15 days in a month I take Alprex, and it helps me in good sleep.
No, please don't do that. You should try to slowly taper off the usage.
Okay.
It's not good in the long run because there is always this dependence thing, sort of getting into the skin of your thought, and not a good thing at all.
Because I don't do much of the physical activity. I don't feel hungry. I don't, feel anxiety. I mean, the physical labor is not there. Physical work is not there. I don't exert myself much. It is more of a sitting job. So that is why you don't feel tired. I mean, the sitting makes you tired. That's it. And I take the help of Alprex, and I don't feel hungry also. It's a sitting job. I'm 59 plus, so that's the issue.
Yeah, you hit the nail on the head. It's lack of physical activity. You need to sort of incorporate. Maybe you could walk if it is possible. Maybe inside the house just as well. Or think of yoga. Think of something else. And you need to be active. Get up from your work chair and move around a bit every hour. All these small little things help. And maybe you can, of course, have a light meal. That's okay, fine. But try to avoid all the oily stuff. Make it healthy, and add flaxseed to your diet, and your gut will be fine with it. Like I told during the course of our session, that if you take flaxseed about 1 to 2 tablespoonful, in powdered form or roasted, it will definitely help your gut. And once your gut is clear, you're absolutely fresh all through the day.
And plus, I'm a bit overweight also because of the sitting job and all that. I used to do the yoga.
Yeah. But the thing is, all our ill health comes from the gut. So if you keep your gut in good shape, you won't have any problems.
Thanks a lot, sir. Thanks a lot.
Welcome. Yeah. You can connect sometime, through relationship manager.
Okay.
And I'll take your case, and don't worry, we'll try to help you.
Okay. Right, sir. Thank you, sir. Thank you.
Welcome.
Thank you.
So thank you so much, Dr. Raj, for again giving us a very insightful session, and it's always a pleasure to connect with you. And whatever you've told us, like some things are common, but जैसे इन्होंने बोला, हम खुद ही अपनी problems आधी बात समझ जाते हैं हम क्या गड़बड़ कर रहे हैं. But yet, habitually we are unable to break our habits and do something different, whether it is our eating habits or whether it's physical activities or things. And small things, जैसे आपने flax seeds का बोला, ये सब.
You need to know voice.
Mute. Ritu, you were on mute.
Okay, somebody's very nicely muted me also. Wonderful. So now nobody can complain कि हम लोग सिर्फ आपको mute करते हैं, मुझे भी mute कर देते हैं. So as I was mentioning, बहुत सारी चीजें हैं जो हमें बहुत ज़्यादा help करती हैं to remain healthy, and food related चीजें हैं. जैसे इन्होंने बताया कौन सी चीज कैसे हमें intake वगैरह के बारे में बहुत ध्यान रखना चाहिए, and how medicinally it can help us. That is extremely important. So I think these are just small things which we all need to take care of. हम लोग सब सुनते हैं एक जगह and then we completely forget about it. And कोई एक चीज याद आती, बाकी 10 चीजें भूल जाती हैं. So I wish we could follow exactly what he keeps telling us to all have a healthier life. So because जैसे हम कहते हैं ना, हमारा शरीर स्वस्थ रहेगा तो हम स्वस्थ रहेंगे, हमारा दिमाग स्वस्थ रहेगा, and life would become simpler. I think every day when we get up with lot of problems, चाहे वो छोटी सी होती है, but in the body it manifests itself and it makes you very, very uncomfortable. So maybe small changes in life, in food, in different things can actually make a difference to your health. So So once
Yeah, very
again,
true.
Dr. Raj.
Thank you so much, Ritu, for the
It was a pleasure to have you, Dr.
invite
Raj,
and for the opportunity to speaking to you guys again.
Always a pleasure, Dr. Raj. And in fact, if you all connect with Dr. Raj, Dr. 360 has come out with a wellness magazine also, which I generally found very interesting. I have just gone through it when he sent it to me.
And we featured you in our first inaugural issue.
That I wasn't mentioning, Dr. Raj.
You should promote, world famous in India.
Actually, very kindly, they kind of featured me for, they had asked me a few questions, but then it became a huge, big interview, and I think
he has become celebrity.
Not
he
at
has
all.
Become celebrity now.
Not at all. I think very, very kind of him to do that.
We feel you a celebrity.
Right. Thank you.
So what happened was a very simple thing, Ritu. I just thought, who should I feature, in our inaugural issue as face of the fortnight. Suddenly I thought of you. That's all. Very simple.
Thank you so much. In fact,
thank you for having taken the time to respond.
Not at all.
सेलिब्रिटी तो है ही है रितु ऑलरेडी
ये बस आप लोगों का प्यार है कोई सेलिब्रिटी नहीं हुई
she is humble
nothing else
she is humble also she's very humble
wonderful
very
person
humble.
God bless her
thank you thank you so much. So in fact, from day one, Dr. Raj and me have had a wonderful conversation every time we have connected. It's been wonderful speaking to him. Knowing the kind of things that he does is absolutely amazing. So hats off to him for doing all this. And I don't know for how many topics he has so much of knowledge. It's so amazing. But
not at all. Just a speck of dust on the map of knowledge.
See, that is known as humbleness. So anyway, with that, let's come to the end of today's session. And thank you so much once again, Dr. Raj, for this wonderful session that we had with you and for being so patient for all the questions. And thank you, ladies and gentlemen, for joining us here today on Mo TV. And now we will see you all tomorrow morning at okay, Ranjana Ji's at least said 8 o'clock. Rest nobody said. So let's all meet at 8 o'clock sharp for a physiotherapy show. At 12, we have a education club session, practice session. And in the evening, I see you all with some chai pe charcha. So till then, keep smiling, be happy, and eat well and look after your health.
Thank you.
Thank you, everyone,
and see you all.
Bye.